Imagine this for a moment. Every morning you take your vitamin D supplement with a glass of water. You rarely miss a day. Months go by, and you feel confident you're doing something good for your health. Then your next blood test comes back, and your doctor says your vitamin D level is still low. You can't help but wonder, how is that even possible? If this sounds familiar, you're certainly not alone. Thousands of adults, especially those over the age of 50, faithfully take vitamin D every single day. They expect stronger bones, better muscle function, and support for their immune system. Yet many still struggle with low vitamin D levels, or continue to experience symptoms like tiredness, muscle weakness, or aching bones. It can feel confusing and frustrating. Most people immediately assume the solution is simple. Just take a bigger dose. But here's something that often surprises people. More vitamin D isn't always the answer. In fact, taking larger amounts without understanding the real problem may not solve anything at all. The truth is, swallowing a vitamin D capsule is only the beginning of a much longer journey. Before your body can actually benefit from that supplement, it has to pass through several important steps. Think of it like ordering a package online. Clicking the buy button doesn't mean the package instantly appears at your front door. It still has to be processed, shipped, delivered, and finally opened before you can use what's inside. Vitamin D works in a surprisingly similar way. If even one step in that journey doesn't work properly, your body may not get the full benefit, no matter how carefully you follow your daily routine. That's why some people remain deficient despite doing what they believe is everything right. In today's video, we're going to uncover 7 hidden reasons your body may not be absorbing or using vitamin D the way it should. Some of these reasons are quite common, while others are rarely talked about outside a doctor's office. Along the way, you'll learn simple, practical strategies that may help you get more from your vitamin D safely and effectively. And be sure to stay until the end, because the final reason is one that many people overlook completely, yet it can make a surprising difference. Before we look at what can go wrong, let's first understand what vitamin D actually has to do inside your body. Before we dive into the 7 hidden reasons your body may not absorb vitamin D properly, it helps to understand what vitamin D actually does. Don't worry, this won't be a complicated science lesson. In fact, once you understand the basics, everything else in this video will make much more sense. Most people think vitamin D is just another vitamin, like vitamin C or vitamin B. But here's something interesting. Vitamin D behaves more like a hormone than a traditional vitamin. That simply means it acts as a messenger, helping different parts of your body communicate and work together. It plays an important role in keeping your bones strong, supporting healthy muscles, helping your immune system function normally, and even assisting many other cells throughout your body. Your body gets vitamin D from 3 main sources. The first is sunlight, when your skin makes vitamin D after being exposed to the sun. The second is food, although only a few foods naturally contain meaningful amounts. The third is supplements, which many adults take every day, especially as they get older. Now, imagine vitamin D is a package you've ordered online. Receiving the package at your house isn't the same as actually using what's inside. The box still has to be opened, the contents unpacked, and the item put where it belongs. Your body handles vitamin D in a very similar way. The journey begins in your intestines. If you swallow a supplement or eat vitamin D-rich food, your intestines must first absorb it. If this first step doesn't happen well, the rest of the process cannot move forward. Here's another simple way to picture it. Buying a light bulb doesn't brighten your room. You still have to take it out of the box, screw it into the socket, and flip the switch. Only then does the light appear. Vitamin D works much the same way. Taking the supplement is only the first step. Every stage afterward matters just as much. This explains why someone can faithfully take vitamin D every day and still struggle with low levels or ongoing symptoms. The problem isn't always the amount they're taking. Sometimes the journey gets interrupted before vitamin D reaches its final destination. Now that you know how many steps are involved, let's look at the first place where the process commonly breaks down. Section 3. The first reason is also one of the easiest to fix, and it surprises many people. You may be taking the right supplement at the right dose every single day, but you're taking it in a way that makes it harder for your body to absorb. Vitamin D is what doctors call a fat-soluble vitamin. That sounds technical, but the idea is actually very simple. Fat-soluble means vitamin D dissolves much better in fat than it does in water. Your digestive system is designed to absorb it more efficiently when a small amount of healthy fat is present during the meal. Think of it like trying to wash greasy food from a pan. Water alone doesn't work very well, but add the right cleaning agent and suddenly everything comes together. In a similar way, dietary fat helps your body handle vitamin D more effectively. Now think about a common morning routine. You wake up, pour yourself a cup of coffee, swallow your vitamin D capsule with a glass of water, and rush out the door without eating breakfast. It feels like you're building a healthy habit, but research suggests this routine may not allow your body to absorb vitamin D as efficiently as it could. The good news is that you don't need a large, heavy, or high-fat meal. A modest amount of healthy fat is often enough to support absorption. That could be a couple of eggs with breakfast, a spoonful of yogurt, a handful of nuts, slices of avocado on whole grain toast, or a salad drizzled with a little olive oil. These are simple foods many people already enjoy, and they may help your body make better use of the supplement you're already taking. This is also a good time to clear up a common misunderstanding. Some people hear that vitamin D needs fat and assume they should eat greasy fast food or large amounts of butter whenever they take their supplement. That's not the goal. Your body doesn't need excessive fat. A balanced meal containing healthy sources of fat is usually all that's needed. If you usually take your vitamin D on an empty stomach, don't feel discouraged. It doesn't mean you've been doing something terribly wrong. It simply means there may be an easy adjustment worth trying. Sometimes the smallest habits can make a meaningful difference over time. Of course, taking vitamin D with healthy fat isn't a magic solution for everyone. If your vitamin D levels remain low despite making this change, there's probably another reason your body isn't absorbing or using it as expected. That's exactly why we're exploring all 7 possibilities today. A simple habit to remember is this: instead of thinking about when you take your vitamin D, think about what you're eating when you take it. Pairing your supplement with a balanced meal that includes a little healthy fat may give your body a better opportunity to absorb this important nutrient. But even if you're taking vitamin D correctly, your digestive system itself may still prevent your body from absorbing it. Even if you're taking your vitamin D with a healthy meal that contains some fat, there's another important question to ask. Is your digestive system actually absorbing it? Most of us rarely think about our intestines unless something feels wrong, but every day, your digestive system performs an incredible job. It breaks down food, pulls out vitamins and minerals, and sends those nutrients into your bloodstream so the rest of your body can use them. If that process isn't working properly, even the healthiest diet or the best supplement may not deliver the benefits you expect. A simple way to picture this is to imagine a clean, dry sponge. When you place it in water, it quickly soaks everything up. Now imagine that same sponge is covered in plastic. No matter how much water you pour on it, very little gets inside. Your intestines work in a similar way. Healthy intestines are excellent at absorbing nutrients. But when disease or damage affects them, they may struggle to absorb vitamin D and other important nutrients. One condition that can interfere with absorption is celiac disease. This happens when the immune system reacts to gluten, a protein found in foods like wheat, barley, and rye. Over time, that reaction can damage the lining of the small intestine, making it harder to absorb nutrients, including vitamin D. Another example is Crohn's disease. This inflammatory condition can affect different parts of the digestive tract and may reduce the body's ability to absorb fats and fat-soluble vitamins. Ulcerative colitis, another form of inflammatory bowel disease, mainly affects the large intestine. While its effects on vitamin D absorption are sometimes less direct, research suggests people with ongoing intestinal inflammation are more likely to have low vitamin D levels. Chronic pancreatitis is another condition worth mentioning. The pancreas produces digestive enzymes that help break down food, including fats. If the pancreas isn't making enough of these enzymes, fat digestion becomes less efficient. Since vitamin D depends on normal fat absorption, this can make it harder for your body to take in the vitamin, even if you're getting enough from food or supplements. Previous weight loss surgery can also play a role. Certain procedures change the way food moves through the digestive system or reduce the area where nutrients are absorbed. While these surgeries can provide important health benefits for many people, they can also increase the risk of vitamin deficiencies, making regular follow-up care especially important. Now, this doesn't mean everyone with low vitamin D has one of these conditions. In fact, many people do not. But if your vitamin D remains low despite taking supplements exactly as directed, it's worth considering whether an underlying digestive issue could be part of the picture. Sometimes your body gives clues. Persistent diarrhea that doesn't seem to improve, unexplained weight loss, frequent bloating, or stools that appear pale, greasy, oily, or difficult to flush can all suggest that fat isn't being absorbed normally. These symptoms don't automatically mean you have a serious disease, but they are signs that deserve a conversation with your healthcare provider rather than being ignored. The reassuring news is that identifying the real cause can make a big difference. Instead of simply increasing your vitamin D dose again and again, your doctor may recommend testing for an underlying digestive condition or adjusting your treatment plan. Once the root problem is addressed, your body may be much better able to absorb the nutrients it needs. Remember, supplements can only work if your digestive system is able to bring those nutrients into your body. When absorption is impaired, solving the underlying problem is often just as important as choosing the right supplement. Sometimes the problem isn't your gut at all. It may actually be hiding in your medicine cabinet. If your digestive system is healthy and you're taking vitamin D with a meal that contains some healthy fat, you might assume you've covered all the bases. But there's another possibility that often goes unnoticed. The answer may be sitting in your medicine cabinet. This is an especially important topic because many adults over 50 take one or more prescription medications every day. These medicines play a vital role in treating chronic health conditions, and for many people, they are absolutely necessary. That's why I want to make one point very clear from the beginning. Never stop taking a prescribed medication on your own because of something you hear in a video. If you have concerns, the safest step is always to talk with your healthcare provider. So, how can a medication affect vitamin D? Some medicines can reduce how well your body absorbs vitamin D from the digestive tract. Others can change the way your body processes or breaks down vitamin D after it has already been absorbed. In other words, the supplement may enter your body, but it may not stay around long enough or be converted into the form your body needs. For example, certain medications used to treat seizures can increase the speed at which the body breaks down vitamin D. Research has found that people taking some of these medicines for many years may have a greater risk of low vitamin D levels, especially if they are not monitored regularly. Long-term use of certain steroid medications is another example. These medicines are often prescribed for conditions such as asthma, autoimmune diseases, or severe inflammation. While they can be very effective, prolonged use may interfere with bone health and affect vitamin D metabolism, making it even more important to keep an eye on vitamin D status. Some cholesterol-lowering medicines that work by reducing fat absorption can also make it more difficult for your body to absorb fat-soluble vitamins, including vitamin D. Remember what we discussed earlier. Vitamin D needs normal fat absorption to enter your bloodstream efficiently. If that process is reduced, vitamin D absorption may also decrease. The same idea applies to certain weight loss medications that limit the absorption of dietary fat. These treatments can be helpful for some individuals under medical supervision, but because they reduce fat absorption, they may also reduce the absorption of fat-soluble vitamins. For this reason, healthcare providers often recommend monitoring vitamin levels and, when appropriate, adjusting supplementation. It's important to remember that this doesn't mean these medications are harmful or should be avoided. Every medication has benefits and potential side effects, and your doctor prescribes them because the expected benefits outweigh the risks for your specific situation. The goal isn't to create fear. The goal is simply to understand the whole picture. If you're taking one or more long-term medications and your vitamin D levels remain low despite consistent supplementation, it may be worth asking your healthcare provider a simple question. Could any of my medications be affecting my vitamin D? That conversation may lead to blood testing, dose adjustments, or a different supplementation plan that better fits your needs. Sometimes the solution isn't taking more vitamin D. Sometimes it's recognizing that another factor is quietly getting in the way. By working together with your healthcare team instead of making changes on your own, you give yourself the best chance of finding a safe and effective solution. Even if your intestines absorb vitamin D perfectly, your body still isn't finished with the process. By now, you've seen that getting vitamin D into your body is only part of the story. But here's another fact that surprises many people. Even after your intestines successfully absorb vitamin D, it still isn't ready to do its job. It has to go through two important processing steps before your body can truly put it to work. Think of it like a factory producing a useful product. Raw materials arrive at the factory every day, but they can't be sold or used immediately. They first move through different departments where they're processed, assembled, inspected, and prepared for use. If one department slows down or stops working properly, the finished product never reaches its destination, even though the raw materials arrived on time. Your body handles vitamin D in much the same way. The first stop is the liver. After vitamin D is absorbed from food, sunlight, or supplements, it travels through your bloodstream to the liver. Here, the liver changes it into a form that can continue its journey. You can think of this as the first stage of preparation. The vitamin has been received, but it still isn't fully active. Next, it travels to the kidneys. These remarkable organs do far more than filter waste from your blood. One of their many jobs is to perform the final activation step. They convert vitamin D into the form that your cells can recognize and use. Only after this final step can vitamin D help support healthy bones, muscles, nerves, and many other important functions throughout the body. Now imagine what happens if the liver or kidneys aren't working as well as they should. Even if you take your supplement every single day and absorb it perfectly through your intestines, the activation process may not happen as efficiently. It's a little like having ingredients for a meal sitting on the kitchen counter, but no one available to cook them. The ingredients are there, but they never become the finished meal. As we grow older, this becomes more important. Aging itself can gradually reduce how efficiently certain organs perform their jobs. In addition, chronic liver disease or chronic kidney disease can further affect the body's ability to activate vitamin D. Research suggests that people living with these conditions are more likely to have problems with vitamin D metabolism and may require individualized medical care. This is one reason why simply buying a stronger supplement isn't always the answer. If the issue lies in the activation process rather than the amount you're taking, increasing the dose may not fully solve the problem. Instead, your healthcare provider may recommend blood tests to evaluate not only your vitamin D level, but also your liver function, kidney function, and overall health. These tests help identify where the process may be breaking down. The reassuring news is that understanding the cause allows for a more personalized approach. Rather than guessing, your doctor can recommend the most appropriate treatment based on your specific situation. In some cases, that may involve different forms of vitamin D or closer monitoring over time. The important message is this: vitamin D doesn't work alone. It depends on healthy organs completing each step of its journey. When one step is interrupted, the entire process can be affected. Here's something many people never hear about, and it may explain why supplements still don't seem to work. Now, we're getting to one of the most overlooked pieces of the vitamin D puzzle. Many people focus entirely on the vitamin itself, but they never consider that another nutrient may be helping it work behind the scenes. That nutrient is magnesium. If you've never heard about the connection between vitamin D and magnesium, you're not alone. It's a topic that doesn't receive nearly as much attention as it deserves. Yet research suggests magnesium plays an important role in the body's ability to process and use vitamin D effectively. Think of vitamin D as a key that's designed to unlock many important functions in your body. Magnesium is like the hand that turns the key. Without enough magnesium, that key may not work as smoothly as it should. The vitamin may be present, but your body may have a harder time activating and using it efficiently. Magnesium supports many chemical reactions throughout the body, including those involved in vitamin D metabolism. In simple terms, it helps your body move vitamin D through the different steps we've already discussed. That's why some people continue to struggle with vitamin D even when they're taking supplements consistently. So, how do you know if your magnesium might be low? Unfortunately, it's not always obvious. Some people have no noticeable symptoms at all. Others may experience muscle cramps, muscle twitches, unusual fatigue, weakness, or a feeling that they simply don't have their normal energy. These symptoms can have many different causes, so they don't automatically mean you're low in magnesium. Still, they may be worth discussing with your healthcare provider, especially if they persist. The encouraging news is that many magnesium-rich foods are already part of a healthy eating pattern. Pumpkin seeds are one of the richest natural sources. Almonds are another excellent choice and make a convenient snack. Spinach provides magnesium along with many other beneficial nutrients, while beans offer a combination of magnesium, fiber, and plant-based protein that supports overall health. Rather than thinking about one superfood, it's more helpful to aim for a balanced diet that regularly includes a variety of these foods. Small improvements made consistently often have a greater impact than dramatic changes that are difficult to maintain. You may be wondering whether you should simply start taking a magnesium supplement along with your vitamin D. While supplements can be appropriate for some people, more isn't always better. Too much magnesium from supplements can cause unwanted side effects, especially digestive problems, and certain people with kidney disease need to be particularly cautious. That's why many experts recommend a food-first approach whenever possible and suggest discussing supplements with a healthcare professional if you think you may be deficient. The key takeaway is reassuring. Sometimes improving vitamin D isn't only about adding more vitamin D, it's about making sure your body has the supporting nutrients it needs to use that vitamin effectively. Looking at the bigger picture often leads to better long-term results than focusing on a single pill. But nutrients aren't the only factor. Your own body composition can also change the picture. Our next reason is one that deserves to be discussed with care because it's often misunderstood. If you have a higher body weight, especially if you carry more body fat, it does not mean you've done something wrong. It also doesn't mean your body can't benefit from vitamin D. It simply means your body may handle this nutrient differently. Research has found that people living with obesity are more likely to have lower vitamin D levels in their blood. At first, this can seem confusing. If two people take the same amount of vitamin D every day, why might one person's blood level be lower than the other's? A simple analogy can help explain it. Imagine your body has several storage rooms. Vitamin D is a fat-soluble nutrient, which means some of it can be stored in fat tissue. If there is more storage space available, more vitamin D may be held there instead of remaining in the bloodstream where blood tests measure it. Think of it like storing supplies in a large warehouse. The supplies haven't disappeared, they're simply being kept in storage rather than sitting on the delivery truck ready for immediate use. This helps explain why some people with higher body fat may need a different approach to maintaining healthy vitamin D levels. It isn't because the vitamin has stopped working or because their bodies are somehow failing. Their bodies are simply distributing and storing vitamin D differently. The important message here is to avoid comparing yourself with someone else. The dose that works well for a friend, neighbor, or family member may not be the right dose for you. Vitamin D needs can vary from person to person based on age, overall health, body composition, medical conditions, and even how much sunlight someone receives throughout the year. That's why individualized medical advice is so valuable. If your vitamin D levels remain low despite taking supplements consistently, your healthcare provider may recommend blood tests and, if appropriate, adjust your dose based on your specific situation. This is much safer than guessing or taking very large doses on your own. Lifestyle habits also play an important role. Eating a balanced diet, staying physically active, managing weight gradually if recommended by your healthcare provider, and following a personalized treatment plan may all contribute to better overall health, including healthier vitamin D status. The goal isn't perfection, it's making steady, sustainable improvements that support your body over time. So if you've been frustrated by low vitamin D levels, don't blame yourself. Understanding how your body works is far more helpful than judging it. Once you know the factors involved, you can make informed decisions together with your healthcare team. Our final reason is one of the biggest misconceptions, and it affects millions of people. We quote, "We reached our final reason, and it's one of the most common misconceptions about vitamin D. Many people believe that if a little is good, then more must be better. Others expect to see results within a few days or weeks. Unfortunately, that's not how vitamin D usually works. The truth is that there is no single vitamin D dose that's perfect for everyone. Your age, overall health, body weight, diet, medications, medical conditions, and even where you live can all influence how much vitamin D your body needs. That's why two people taking the exact same supplement may end up with very different blood levels. Another important point is that vitamin D doesn't work overnight. Building healthy vitamin D levels is often a gradual process. Research suggests it can take weeks or even months for blood levels to improve after starting supplementation, depending on the person's starting level and the dose prescribed. Patience and consistency are usually much more effective than making frequent changes. This is where blood testing becomes so valuable. Rather than guessing whether your supplement is working, a blood test gives your healthcare provider real information about your vitamin D status. It also helps determine whether your current dose is appropriate or whether another underlying issue should be investigated. Let's take a moment for a quick myth versus fact. Myth: if my vitamin D level is low, I should take the highest dose I can find. Fact: more isn't always better. Very high doses of vitamin D can be harmful if taken without medical supervision. Too much vitamin D can raise calcium levels in the blood, which may lead to nausea, weakness, kidney problems, and other serious health concerns. The safest approach is taking the right dose for your individual needs, not simply the biggest dose available. Myth: if I don't feel better after a week, the supplement isn't working. Fact: vitamin D works gradually. Improving blood levels and supporting your body's normal functions takes time. Consistency is far more important than expecting immediate results. This is also why follow-up testing matters. If you've been taking vitamin D for a while, your healthcare provider may recommend repeating your blood test to see how your levels have changed. That information allows your treatment plan to be adjusted safely instead of relying on trial and error. The biggest lesson from today's video is that successful vitamin D supplementation isn't just about buying a bottle off the shelf. It's about understanding how your body absorbs, processes, activates, and uses this important nutrient. Now let's pull everything together into a simple action plan you can start using today.